I'm about to go live in a couple of seconds. Okay.
You know, when you start doing something, everybody's texting and carrying.
Right.
It looks like we're live, actually.
Good, good. Okay.
Now streaming live, according to what I see here.
Okay. It didn't show up on mine yet. Let me see here. Okay. Well, welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonya Johnson. I'm a board certified dermatologist and also a best-selling author. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. So today I have a guest. On, and Dr. Jada, and she's here, and I'm going to have her to introduce herself.
Good morning, everyone. I'm Dr. Jada. I'm your weight loss and wellness expert. I am board certified in both family medicine and obesity medicine. It's my job to help you not only look great, but feel better and live your best life now.
Great. Well, Dr. Jada is here. We're going to talk about, as you can see the title, Inside Out, the gut and the skin, and how are they related? And what I've realized as I've been talking to a lot of my doctor friends, the skin is so related to so many different things. And I don't even think about it. So that's why I have Dr. Jada here, and she's going to talk to us about how the gut and the bacteria in the gut actually can affect the skin. Dr. Jada?
Yeah, thank you so much, Dr. Sonya, for having me. And this is a really important and growing topic. There's so much research that's still underway. Quite a bit, though, now that we're seeing that makes associations between the gut and the health of the gut in relation to its microbiome, which I'll describe in just a moment, but also how it relates to so many different organ systems. And that may show up in places like the skin, but it also shows up in the mental health area with depression. It can show up in terms of metabolism with obesity. Also, it shows up even in areas with chronic and autoimmune conditions like arthritis, even diabetes, and inflammatory bowel disease. So this is a very, very interesting phenomenon that we're seeing in the healthcare world and in the wellness world particularly, because this is something that we've known for quite a while, but the studies and research has really started mostly in the 1990s.
Okay.
The relationship I think we can focus on today in terms of the skin. Obviously, you're a dermatologist, and that's your wheelhouse, and that's what we will focus on. There are three common places that the gut seems to have influence or have a relationship in terms of skin health and therefore skin disease as well. And those three areas are acne, atopic dermatitis, and psoriasis, which is considered an autoimmune condition. So those are three of the areas that we see mostly in the skin area as it relates to the gut and the microbiome. And what we found is that there's this relationship between the gut and the skin, and how the skin is able to maintain its own homeostasis or its own appropriate balance. So what is the microbiome? The question may be, so it's a long word, kind of a scary word, and it's a tongue twisting word as well. But in short, the microbiome is a combination of trillions bacteria. Yeah, exactly. That line the adult intestine, and what lines the intestine in general, lines the intestines, particularly in the lower or the lower intestine. And so these bacteria in the intestine, much like bacteria on the skin, which you could probably speak to, have a job to do. So it's important for them to be in the right ratios and the right combinations of all of these different bacteria, because they also have a genetic role that tells them what to do and what not to do. So they actually have to play really, really well together. And when they don't play well together, then they don't protect us as well from our immune systems and things like that. And so we're more susceptible to health conditions that we otherwise in the past have not related to such an interesting and distant cause. So that's kind of in short, the whole microbiome is a combination of many bacteria that have genetic material that tells it what jobs to do and where.
Okay, interesting. You know, I know when I was at my last meeting, they talked about how those same microbiomes are actually on the skin. And you, and like when you said trillions, that's an understatement. And we just had, like you said, just begun to really look into that. And what they found is when we use harsh ingredients on the skin, you disrupt that symbiotic relationship they have. And
Yes.
that's what actually is leading to more eczema and flares of the skin that we see, a dry skin. And that's because you have disrupted that symbiotic relationship. And the thing is, we don't even know what works for them, what helps them. And so what I know, the genetic aspect of that, they were actually trying to make products that will help restore that relationship. And when they found it, when you keep that relationship intact, the skin does very well, very well. And so we're it goes against our belief system that all bacterial is bad, when in fact that's not the case. And so that's what they were saying about the skin, for especially with eczema patients, that we're disrupting that when we use these harsh chemicals. And so I agree with you when it comes to the inside gut lining, we have the same situation going on. And so so thank you for bringing that up, because we, like I said, we have nothing for it because we don't know. We're still learning, on the skin, outside of the skin anyway. But definitely, what all else do you have to say about the relationship? I mean, so when we do take antibiotics, does that disrupt that relationship also?
It does. And antibiotics is one very common culprit with disrupting the balance of the bacteria that are in the gut. By lowering some of those that have a beneficial effect. And I think it's worth taking a moment here to kind of piggyback on what you said earlier about all bacteria isn't bad. It really is kind of a defense system. It's like an army for us, and its job is to regulate what's coming in and out and the impact that it has on our body. So bacteria's role is to be a part of that defense. So the importance of the balance that we talk about is having the right amount of the bacteria that can go to bat for you when something's not going well, and then the right amount of the bacteria that can enhance certain functions of the body so that the body is able to metabolize and able to function as well as it should. So they are both very, very, very important. The beneficial bacteria as well as the fighting bacteria, which is still beneficial. So when we see that gets out of balance, sometimes it is antibiotics. And what we found is it doesn't have to be antibiotics from yesterday or last week or a month ago. These are things that can be ongoing from antibiotic exposure for years preceding the event or the onset of symptoms like psoriasis, which, as you know, is not only a skin condition, but it's also a rheumatologic condition that affects joints.
Right.
What we know is that antibiotics can have a role. And that's why it's so important as we educate our communities and our patients and take the time. For patients, it's important to understand why we must judiciously use antibiotics. In other words, we can't use antibiotics just for everything, just because we get off and we need an antibiotic. Really, antibiotics have to be used and prescribed for specific conditions with the expectation of a specific outcome. So gone are the days that we can just say, here, take antibiotics, because resistance issue, but now we're dealing with potentially making our health even worse in the long run. So yes, your antibiotics can be a big culprit.
You know, and it's funny because you don't think about that when when people want antibiotics, they just want to take care of the problem. And you see it mainly when you have, like I say, erythromycin. Everybody know that would cause stomach problems, but, when you have your other antibiotics that normally does not cause a disruption with the stomach that you can tell. But like you're saying, because we're looking at some really very minute microorganisms that we definitely can't see, but it does disrupt that. And it does cause a problem. We just don't know what it is, So I have a question, what could people do to try to, if they have to take an antibiotic, sometimes you just got to do what you have to do. But if you have to take an antibiotic, what can we do to restore that, that relationship? Because I know for the skin, they haven't found anything yet. They're working on it. They haven't found it. So what do you recommend that people can do? One, to try to, if they know they have to take an antibiotic, what can they do to prevent problems? If there's a way you can take care of this, and definitely if you take the antibiotic, what do you need to do after the fact to try to restore that, relationship?
Right. That's a great question. And I think a lot of times now we are seeing people are becoming aware of the use of probiotics. Probiotics meaning for bios or for the biologic system. And so probiotics can be very, very helpful, whether you are currently taking antibiotics or have taken them in the recent past or have taken them for a long period of time in the past as well. So probiotics can be very, very helpful for restoring the bacteria in the gut that do belong there. Because that's one thing about antibiotics. When we prescribe them, we should be prescribing them specifically to cover the organisms that we know are causing that condition and be as narrow as possible and not broad spectrum, like against everything, but against this particular organism.
Right.
Many of them. So being able to take probiotics is important. But one of the things I find in my practice is that people don't take them long enough. There's this expectation that I can eat yogurt and with probiotics in it and things will be fine after eating yogurt for a couple of days. Where some people will take probiotics and they have not given the probiotics a long enough time to really begin to have its effect. Or so you take it, and you're like, oh, I took the probiotics and they didn't work. Well, we didn't give it a chance to work. And the other thing with probiotics is the quality of the probiotic. All of them are not created equal. So,
okay. Right.
So we want to make sure that when we're taking the product, that it's a high quality product. It's a product that has at least 5 different strains of different bacteria. And we need to know that the count of the bacteria is high enough. But we need to make sure that we're taking it for the right length of time to be able to get the effect of it. Some other things about probiotics is how they're stored. Sometimes the bacteria can be temperature labile. So certain temperatures will cause it to be ineffective. So you need to know, sometimes that's why you see some probiotics are in a cool environment or in the refrigerated section and some are on the shelf. So it's just important to be able to differentiate between those. And sometimes you just need to go to a reputable source. And if it's a health food store, talk with the attendants and really get a sense of that product line and what they've seen in terms of results. Other things is that you can get probiotics through foods. So those that are probiotic friendly, natural sources of probiotics. And those are going to be your fermented foods that like sauerkraut or foods that have been fermented, allowed to stand. You can buy that in juices now or in drinks like kombucha. You see that these days. Kimchi, you can find that as well in certain farmers market type stores, and kefir, which is a drink that kind of reminds you of yogurt, but a little bit more bitter.
Okay.
Yeah.
So, I know that with probiotics. And it's funny because I'm glad you mentioned how many strands, minimal, because I know when I go to the store, I'm like, get the highest one, just get the highest one. So
yeah,
I don't know if it's
that's
good,
a good
but
one.
okay, fair enough. And what
Fair
I
enough.
do, I actually look at the back and compare what did this have that this does not have, and so that's what I do. But let me tell you, I can tell a difference with probiotics. I can tell a big difference. I mean, it regulates you, and I don't feel bloated. I love my probiotics, and so I take them religiously every day. Now I do have a question because I came across the liquid ones, and I read somewhere is it pre-probiotics out there? And I only say that because I know for kids with eczema, they were saying for babies to give, if you have a baby that, is prone to eczema, you can give them this and that'll help try to prevent, the onset of eczema or the significant flare of eczema, But what is your thoughts on that?
So if I understand you, there are prebiotics as well. Prebiotics are is essentially like a type of carbohydrate, a non-digestible carbohydrate. Essentially, those can be very, very helpful for encouraging beneficial bacteria to multiply in the gut. So the prebiotics are a nice balance to the probiotic. It's like they feed those. I'm getting a signal about my internet. Are you still seeing me? We still okay?
I still see you was breaking up some. So if you don't mind repeating that part, the prebiotics and the probiotics, what's the difference? Because that's when you were breaking up, if you don't mind.
Okay, sorry about that, guys. You having this shift. Everybody's in the house doing different things.
Right. Everybody's on the computer.
Right. So you got to find a hat out. But so prebiotics is essentially like a non-digestible carbohydrate, what we also see or use or know as fiber. So those can be very, very good for encouraging.
Okay, I'm not hearing you at all.
Oh no.
Okay, now you come here and there.
Oh no.
Okay, now you sound fine. You sound fine.
Good.
I would just say talk slower, maybe. I don't know for sure right now at this moment.
Okay, thanks. I'll do my best.
Thank you.
So prebiotics essentially is a non-digestible carbohydrate. It doesn't break down. What we also know as a fiber or a fiber product or fiber type carbohydrate. So this process with incorporating prebiotic fiber will encourage beneficial bacteria to multiply in the gut. So now we're getting those really, really good quality of bacteria to multiply exponentially in the gut. So prebiotics may even help probiotics become more tolerant over time. So it kind of helps them to work very synergistically together, and you get a little bit more bang for your buck when you can incorporate those, because it helps stabilize temperature and the pH and things like that. So if you wanted to enhance your gut health using prebiotics, you can do that with fiber. Again, you can get certain fibers over the counter, but also there are foods that are rich in prebiotics, and those are going to tend to be like your bananas, asparagus, even onions, believe it or not. And this is one of the ways that we see a benefit for garlic. People will often ask what's the benefit of garlic. This is one of those as a prebiotic. Artichokes can be good for that, as well as whole grain. A high fiber whole grain source can be helpful for those who can tolerate those types of foods.
Okay, good. I didn't even know that. So thank you for sharing that. Anything else you would like our audience to know, Dr. Jada?
Yeah, I think other things, just going to go back to some basics. Sometimes it's not the earth-shattering breaking news that makes a difference. Sometimes it's just really, really basic and consistent, solid practices that really give you the long run effect or the long-term effect of great health. And some of those things are simple as reducing your stress. We know that stress impact the gut is a stress center. That's why people say when they get anxious, they get queasy in the tummy. It's because there are centers there that directly correlate or communicate with the brain. So reducing stress can be an important thing. getting the appropriate amount of sleep. A lot of repair work happens during sleep. So that is really, really important. Along with reducing stress, it's going to help with mood. It's going to help with cognition and being able to be sharp and get the things done during the day with less mental stress. So that makes a difference as well. And the other thing is that we know that there are certain body hormones that are released during sleep that help to reduce inflammation and therefore help to reduce inflammatory conditions. So we're always looking at this immune inflammation type of relationship when we talk about the gut as well. So that's really important. You mentioned earlier something with products that we use on our skin, and sometimes those are just daily products, and sometimes it's things that we may be using that are a little bit more harsh, like when we're cleaning or doing laundry, things that would just strip the surface of the skin. So too many disinfectants. Even we have to think about stuff like hand sanitizer and things like that. So this is the kind of time when we're using a lot of different things to keep our homes clean. So we just have to really think about that and how it can impact us as well. Smoking is another thing we need to be aware of. And you probably can speak on smoking as it relates to the skin as well.
Yes, and you're right. It just shows again how the skin, is very sensitive organ, even though it does an awesome job of protecting us. But it, a lot like you said, those harsh chemicals that we are using, bleach and Lysol and all these sprays and whatever we're using to clean our counters with to make sure we don't get infected with, COVID-19. All those things can be harsh to the skin. And so I just recommend people use gloves, wash your hands before using a glove, then put your glove on, do your cleaning, definitely wear a mask because, you're inhaling all these products. But then after you're done, wash your hands again and again, moisturize. But, and we wash our hands so much more. So that's another thing. But definitely, like I said, the skin, we talked about those microbiomes, and just like in the gut, we have the same issues on the skin. It's just that on the skin, they're just learning about it. And so we don't know what our products we need that's going to help restore it, like you can tell us about the gut. But I can't say one thing. Whatever we take internally in our bodies, foods and vitamins, that does make a difference for the skin. It does, it travels through the body and it really provides the nutrients that the skin needs to keep doing this job so well. And that's why COVID-19 is not absorbed through the skin, so we, so you just want to, like I tell people, we're back to basics, we're at home. This is the time to slow it down. And like you said, get your rest and really work on taking care of you. Because all we have is our immunity to help with COVID-19. Of course, social distancing, washing your hands, but definitely taking care of our skin by, taking those, precautions. And yes, keeping things clean, and we have to, just like antibiotics, we got to do this right now. We got to use more cleansers right now. But again, take that time to re-moisturize, because that's all we really have to protect our skin is moisturizing. And then as far as internally, like you mentioned, I agree wholeheartedly, really work on that diet, because I'm here to tell you, when they say go home, people got canned foods, they got everything processed. The fresh foods, the live foods, I'm sure people got them, but not that much of it. So we need to start going back to that, but I do want to say this. So I agree with you when it comes to the skin. It's so very much intrinsically linked to the gut, because whatever we take in out of the gut is absorbed in the gut from the time you start chewing your food, and you swallow, all that is absorbed, go through the stomach, the intestines, all that is absorbed, and it does make a difference in our bodies. So I want to thank you for this. We do have some questions in the audience. First of all, I want to thank everyone who did join us today. Dr. Jaquel had a question, and her question was, do you use prebiotics for folks with IBD, irritable bowel disease?
Yes, that's a key thing with irritable bowel is, and just for those that may not be in the medical community with irritable bowel, it is a condition that at first it's a condition of exclusion, making sure that there aren't any other conditions, inflammatory conditions and things like that that affect the gut or the small intestine. But with it, people will have a number of varying symptoms as it relates to the gut. And this goes back even to the gut-brain relationship. And part of that could be just simply an unsettling feeling in the gut with just irritability. If they get anxious, worked up, depressed, they seem to have symptoms there. But it also can show up as kind of waxing and waning in how the gut performs. So these are people that may have constipation from time to time. They may have diarrhea or loose stools from time to time. They may have both of those, just a very temperamental digestive tract. And so prebiotics can be, and fiber can be very, very important for helping to restore some balance in that system. We usually will recommend on the order of about 30 grams of fiber per day on average. And that's really, that's just, even, you know, those of us that don't have irritable bowel really should be really moving towards higher levels of fiber, much higher than what we usually get in our diet. And it is not easy to get that much fiber in your diet. It really isn't easy with the typical American diet. So we really have to be intentional. That means we have to we really have to invest in it. So fiber-rich foods are going to be your fruits and your vegetables, preferably those that have the skin on them. And which a lot of times I find people are ticky, they don't necessarily like the skin on, or now we have so many of our vegetables that have pesticides and wax on them, which can be a very, very problematic when it comes to how the gut is absorbing. You mentioned earlier with absorption. When things come into our system and we have those preservatives in our foods, then they're not really easily and automatically recognized by our digestive tract as food, because it's not really food. So our bodies have to figure out like how to deal with this from an absorption standpoint and how to make sense of these things that are not typically considered to be food products or things that are recognized that way. So anyway, we do have to be very, very mindful of our diet. If those are people who are dealing with irritable bowel, your diet is going to be really important. Reducing sugars in your diet, being mindful of foods paying attention to foods that aggravate that, foods that are heavier, that tend to stay in the digestive tract longer. And certainly prebiotics can be a big, big help for that. Good question.
Okay, thank you. Thank you. Let's see if any other questions. Well, I think everybody agreed to what we were saying. You know, thank you, Jaquel and Dr. Erica, and my cousin, Sean Perriman, thank you for joining. And, you know, like they mentioned, you know, being consistent, you know, and you said that, you touched on that, how what we're doing, you know, prebiotics, probiotics, you just can't do it for a short period of time and that's it. You got to make, and you said you got to be intentional, meaning you got to work at it. You know, sometimes we just got to work at making things a new habit. And so this is where you keep working at it until it's second nature and you don't have to work at it. It's just an easy breezy thing. And you just do what you need to do because this is what we need to do to take care of ourselves. And but I just want to say thank you again for coming on and just explaining how in the world is the skin and the gut related. And there is such a synergistic relationship there where, you know, what you take in is going to show on your skin. As you mentioned with eczema, you know, we didn't really harp on acne, but it's definitely a relationship there. You know, we all know that. And it affects the same way. So again, take home message, I would think, is take your probiotics daily, get your rest, and really be intentional about certain foods you want to eat that is going to help your GI tract as well as your skin. And again, I want to say thank you, Dr. Jada, for joining me. And everyone have a wonderful day. I'm your host, Dr. Sonya Johnson, board certified dermatologist and creator of the Gorgeous RX system. I have women who want to have even and clear skin tone with increased confidence. Well, again, come on tomorrow at noon. Dr. Jada will be joining us, and we're going to talk about sleep beauty rest. You know, myth demystified. So we're going to talk about common myths that you hear, and we're going to tell you the truth about them. So again, see you tomorrow at noon. Take care, everyone. Bye-bye.